wengine wameenda kulazwa huko.
Healthcare workers from 12 counties have threatened to down their tools from Wednesday following delayed salaries from the month of March. This comes as the country is facing a major cash crunch which has adversely affected various sectors, including ministries, parastatals and county administrations. But 3 out of the 12 counties have promised to pay their workers, but the unions say they will not bow to those promises. Helen Aura has that story.
No money, no labor. This is the clarion call across the country's medical fraternity.
We really need to call on the national government, the county government, to find a lasting solution. Because when the county tells us that they have not paid because of not receiving the allocation from the national government, for us, our question is, where does the other counties get money to pay? And where does the national government get money to pay? So this confusion, it's not us to get the clarification. For us, what we want is that no negotiation about pay members, and let's move on.
Echoing those sentiments, the Kenya Medical Practitioners, Pharmacists and Dentists Union says it is time the rubber meets the road, as the health sector has in the recent past been neglected. So far, 12 counties are set to go on a go-slow from Wednesday. Kisumu, Mombasa, Laikipia, Taita Taveta, Vihiga, Nyamira, Nyeri, Murang'a, Embu, Bomet, Nyandarua and Kisii. Health workers in the counties say they have not received salaries and their statutory deductions for the month of March have not been remitted.
Whatever we are saying about these salaries is just the tip of iceberg on the issues happening in the counties. Because there has been delayed disbursement of funds from the National Treasury to the counties, I can assure you that the county or facilities have remained just as structures without necessarily having service delivery. Because the counties cannot pay the drugs. They can't pay suppliers. They can't have the reagents. So necessarily, if you're a doctor or a nurse or a clinical officer, you're in the hospitals and you're seeing a patient, you are very sure that this patient cannot be handled within the facility because of lack of the support and the most important things that are needed for their treatments. So that is the scenario that are there. So the people who are at bigger risk are the public.
The pressure to bring down the cost of living has seen the government face a lot of backlash, and now the opposition has stepped in and is siding with the healthcare workers.
Serikali ambayo inaita serikali haiwezi kuajiri madaktari ambao wamehitimu zaidi ya 4,000. Na ndio madaktari wanasema pia watahakikisha wanatumia haki yao ya kikatiba kufanya maandamano. Mimi binafsi ninawaunga mkono.
So far, Treasury owes counties 122.1 billion shillings, in as much as the medics want the government to step in and disburse the funds to settle the payments. Across, they now are pushing for a centrally managed health system, which they say will ease the burden on the health sector. Helen Aura, NTV.